Hi, welcome back to the channel. My name is Dr. Claire Killingback and I am a senior lecturer in physiotherapy. And in this video, I'm going to talk through the different types of qualitative research design. Now, this can be helpful because as you're reading the different research papers, you'll see all these words used. And essentially, actually, if you can work out, okay, when they're talking about phenomenology, they're talking about lived experience and qualitative research, that will just help you work out which box that research sits in and so how you can be using that research. That's my goal anyway with doing this video. So there are 5 main qualitative approaches: narrative, phenomenology, grounded theory, ethnography, and case study. And then there's a general approach, which I'll talk about at the end. So let's have a brief look at each of these and then an example of each. So, when we're talking about narrative research, I've put this picture at the bottom once upon a time because often narrative research is concerned with stories, and all good stories start with once upon a time, don't they? So, the focus of narrative research is really about exploring the life of an individual. And the problem it's best suited to is needing to tell stories of individual experiences because they can be really rich data and give you a really rich insight into someone's experience of physiotherapy. In terms of what you're analyzing, in the number of people, you tend to be studying one or more individual, but actually it's really, really, really small numbers because you go so deep with people's stories. And the way that you collect the data, it's primarily through interviews, but you can also be using documents as well as part of that. So let me give you an example of a narrative study that I did. And I have to say, this is probably my favorite piece of research I have done so far out of all of them. And this quote comes from the participant. So it's called Being More Than Just a Bog Standard Knee. And that's the role of person-centered practice in physiotherapy. It was a narrative inquiry. So this was one participant, and I did 2 to 3 interviews with them, but they were really, really long, like 1 to 2 hour interviews. So I had lots and lots of data, and I used their data, and I helped craft that data into narrative stories. So it was still their words, their stories, but I crafted it to make sure it made sense as aligned with the research question. I might actually put this paper in the chat just because I think it's really important for all physiotherapy students to read, because it helps you understand what it's like from a patient perspective to be experiencing physiotherapy. So narrative, the key word to remember that is it's about stories. The second type of qualitative research that you'll come across a lot is called phenomenology. And I've put this Muppets picture in the bottom just because there's, like, in the Muppet Show, they have this song called Phenomena. And in my head, like, if you actually YouTube it and watch the Muppets video, it kind of sounds like phenomenology in my head. So I don't know, it might not to you, but it's just a way that I always like. It took me ages to learn how to say phenomenology. So anyway, check out that video if you want a bit of light relief. The focus of phenomenology is about understanding the essence of an experience. And often they will talk about the lived experience. Now, this video is just a really sweeping overview. There are lots of different types of phenomenology, so don't get too bogged down in them. Just remember, if it's phenomenology, it's talking about the lived experience of someone. And it's really best suited for describing, like, the essence of that phenomenon. And you study several individuals that have that shared experience, i.e., they have that shared lived experience. Again, your data collection is primarily going to be through individual interviews with those participants, but you could also use documentation, you could use observation as well. And so, an example of a phenomenology study. So, I worked with one of my colleagues to get this published, and this was where they were looking at the role of incivility within a healthcare team in physiotherapy. And so, when we talk about incivility, we're really talking about how rude people are to each other in practice. So, again, this is a really interesting study that looked at the lived experiences of physiotherapists in terms of whether people were rude to them or whether they were rude to each other. So, again, another really interesting paper to be checking out, but it was that lived experience that we think about with phenomenology. Another type is called grounded theory, and that, as the clue is in the name, it's about developing a theory of something, and you use that from the data in the field. Sorry, you use your data to generate your theory. So it's best used if you are wanting to develop a theory on something. You are studying a process, an action or interaction involving many individuals. Data collection is primarily interviews, and your numbers could range from 20 to 60 depending on how long it takes and how many people to develop that theory. So let's have a look at an example of a grounded theory study. So, this study was about developing a theory on how physio students on placement are empowered. And it was looking at that relationship between autonomy, risk, responsibility. So, in this study, they did 26 interviews with clinical educators because they wanted to understand how they empowered students. And they then analyzed those interviews to develop a theory of empowerment and a theory of disempowerment. So if we look at these pictures here, you'll see there are cycles. So this is a cycle of disempowerment. So they had this theory which says a clinical educator, if they lack confidence in their students' ability and they don't necessarily trust them, then it's really hard for the student to break that cycle because a task will always be supervised by the clinical educator. And then they get that continued close supervision. So the student then becomes really dependent on the clinical educator's presence. The student lacks confidence, they're a bit risk averse. And again, that cycle of disempowerment continues. Versus within this study, they also developed a theory of empowerment. And so that was when a clinical educator gives the students a slightly more complex task, and then the clinical educator gives the student responsibility for an achievable task, so something that was in their power to accomplish safely and well. So it's a low risk task completed without direct supervision. Then the student is debriefed with the clinical educator. The student then experiences that sense of achievement and increased confidence. The educator is then has more confidence in the students and their ability, and then they can be given another slightly more complex task. So hopefully you can see by this that, as an educator, if you read this paper, then you can understand how you can be empowering your students more by giving them progressively difficult tasks versus actually how your behavior can disempower students and inhibit them and reduce their growth. And so this was a theory that they developed. So if you see anything to do with grounded theory, it's a qualitative method and it's specifically looking at generating a theory on something. This fourth type is called ethnography, and this is about focusing on describing and interpreting culture sharing within groups. And it has its roots in anthropology and sociology. So if you see ethnography, it's going to be around the culture of something. And it's best suited for describing and interpreting those shared patterns of culture within a group. It's looking at studying a group that shares that same culture, and they will often use observation as part of their data collection and interviews as well to understand that. So if we look at an example from ethnography, so this study is around the fact that, documentation is a really essential part of our physio practice, because we need it for all that clinical, legal, and ethical reasons. But we know that actually, when we're documenting, that can have an impact on our communication between the patient and the practitioner interaction. So, the aim of this qualitative study was to examine how physios and their patients communicate during episodes of documentation, i.e., they were looking at that culture of documentation. So, if you see ethnography, you're going to be thinking, okay, it's looking at the culture of a particular aspect of practice. And then there's case study. Now, this can be a little bit confusing because quantitative research also has case studies. The difference is that this type of case study collects qualitative data on the views and experiences of everyone who's being studied within that case. So you're looking to develop an in-depth description and analysis of a single case or multiple cases. It's probably most suited to providing an in-depth understanding of those cases. And it could be an event, a program, an activity, more than one individual. So a number of different units of analysis. And you collect multiple different sources of data. So you can do interviews, observation, document, artifact, because you're trying to study that case from multiple angles to really get that depth of understanding on it. So, example of a case study. So, I used a case study in my PhD research where I looked at three different exercise programs that were really successful in having older people come back to those programs week after week, year after year. So, I wanted to study success programs that were successfully helping people maintain that physically active lifestyle. So, to do that, I went and joined in with the programs. I did interviews with the exercise instructors. I did focus groups with the people who went to the exercise programs. I looked at the documentation available on the website and did documentary analysis. I looked at the attendance data, so I had some quantitative data there. So basically, I looked at these cases from lots of different angles to try and understand why these programs were successful, because that's important in helping us understand how we can help older people sustain a physically active lifestyle. So that's an example of a qualitative case study. But not all qualitative studies fall onto one of these five approaches, and sometimes they'll follow what's called a general qualitative approach. And a general qualitative research process, really, you'll notice with this flowchart that it follows the same steps that you would do with any other research study. So it's still a really high quality research process. You're just not quite as wedded to all those philosophical assumptions that are underpinning things like phenomenology or grounded theory. And that can often be because it can be quite explorative in nature, or sometimes there's a lack of funding or there's time constraints, and so you just have to be quite pragmatic to go about collecting your data. So this is an example of a general qualitative approach that I used, and I did this because I wanted to understand the student experiences of feedback. So we mark your work, we give you feedback on it, we spend a lot of time doing that feedback. And actually, I was getting a sense from some of my students that they weren't reading the feedback, they didn't understand it, and it wasn't really useful for them. So I wanted to understand that better so that we could do feedback that was really useful for students. So I did focus groups with the students. And I also wanted to look at the lecturer perspective, but I couldn't get all the lecturers together for a focus group due to their teaching commitment. So I did individual interviews with them. But I analyzed all of that data, put it together, and actually I've really changed my feedback practice based on that research. So this is where it didn't necessarily follow one of the five main approaches. I could have adapted it to follow one of those approaches. It would have led to a slightly different research question, slightly different outcomes. Definitely would have taken me a lot longer, and I just needed the data to improve my teaching practice, to improve the student experience. So that's why I did a general qualitative approach. So overall, we have these five main approaches and then a general qualitative approach. So I hope that's helpful to give you an overview in the main types of qualitative research. Thank you for watching.